Got a 2-year-old first calf heifer that's acutely lame. The owners have treated a couple times with antibiotics with no improvement in lameness. A mild improvement yesterday with some poron vanamine. A little swelling in between the toes, but nothing majorly there on either side. Look in between the toes, pretty normal. Let's see if we can do this one-handed. You would think that where the toes broke off there, she'd be sensitive to hoof testers, but she's not. So we go to the other side where it's not broke off. It has a positive response to the hoof testers. So we are going to go hunting around. We'll clean that foot up. We'll go hunting around and see if we can find where there's an abscess, because I'm betting there is one. After we started cleaning this up, we see some separation in what we call the white line. Some organic debris and material there and there. So we'll follow both of them, and I'm betting we'll find an abscess in one of those spots. So there, we got some fluid coming out. See if we can squeeze a little, yeah. Some of that fluid coming out from an abscess. So we'll relieve all the undermined sole, but this owner did an excellent job at getting this cow in and identifying that it wasn't foot rot before things got too bad. Usually if they're walking around on an abscess, it takes the path of least resistance, which is typically up the foot into the joint. And once you get infection in that joint, we call it septic arthritis. There's really no repairing that. I mean, we can get the infection out of the joint a lot of times, but you have a situation where you have the cartilage destroyed and it's bone on bone. So good job with this owner. Working a little back further in there, it's pretty easy to see where the cavity is. She'd be pretty sound now here in a few days once the pressure comes off there, but we do have to remove all the undermined sole or else it'll just pack full of manure and then create another abscess. So this one's a little different than most of them. Usually we have the whole front of the toe or tip of the toe that's undermined, and then we work back to right about here. But this one actually started at the white line where that hoof was a little overgrown, and the bacteria were able to work up and cause an infection up in here. And some of these are created by stone bruises or bruising on rough ground. And that's probably what I'm most familiar with. It forms a sterile abscess, and then it ends up getting inflamed and infected as time goes on. But this one, I believe, started at the white line and worked up. So it actually was caused by bacterial infection and not rough ground. But anyway, we've resected the sole in the hoof wall. All that were undermined and affected anyway. I will not go up. I usually try not to go up the front or the tip of the toe any further than that, really, because it just takes such a long time to regrow. So we'll get her cleaned up and put a block on this other toe, relieve some pressure, and she should be good to go out and move around. All right, we got our block glued on. As you can see, it's a nice 3/4 block that we've got Bogey Bond put on. It's just a 2-part epoxy that dries pretty fast, and they're pretty robust. And we've got that all paired out, and she should be ready to go. We'll put a little copper tox on it and give her some systemic antibiotics, and she should be sound once she grows that out.